Hi, everyone, and welcome to the AIHM Weekly Wellness Webinar Series. We are thrilled today to have with us Dr. Joshua Rubinstein from Bastyr University that's going to be talking to us about whole body approaches to low back pain. So while folks are coming in, we'll just take a couple minutes. If this is your first time with us, the Academy of Integrative Health and Medicine is a global interprofessional integrative health association working to transform healthcare, body, mind, spirit, community, and planet. And we just are a robust association of lots of different practitioners, from integrative MDs to chiropractors, naturopathic doctors, acupuncturists, massage therapists. And so we just really welcome you into the community. And for those of you, if this is your first time coming to us, and we have a Integrative Health and Medicine Fellowship, which is a 2-year fellowship. And if you have not already started an application or you're just learning about us, you can use this code and let us know you attended Joshua Rubinstein's webinar today, and you'd get a $1,500 off tuition for mentioning that you were a part of the wellness webinar series. So if you're interested in getting more deep education in integrative health and medicine, please reach out. We have a new cohort starting in October. So today I want to welcome our special guest and a dear colleague, just so renowned in the naturopathic community and has just been a long time educator for so many of us. Dr. Joshua Rubinstein is a naturopathic physician practicing in Edmonds, Washington. He's a professor at Bastyr University and also supervises student clinicians at the Bastyr Center for Natural Health. He's currently the clinical sciences chair of the naturopathic medicine program at Bastyr University. And he's a member of the Washington Association of Naturopathic Physicians and on the board. So Dr. Joshua, thank you so much for being with us today. And we're really looking forward to your presentation.
Thank you, Dr. Parker. And I just have to say, it's such a pleasure to see you again and get to work with you again. I just really want to acknowledge all the work you've done for our community as well, especially in expanding the international impact of naturopathic medicine. Just really, really appreciate all the effort you put into that over the years.
Oh, thank you so much.
Absolutely. So we are going to be talking about low back pain today. And I'm just going to share some of my thoughts with y'all, what I've seen clinically be most effective over the years. Go ahead and share screen here. Excellent. All right, so when we think about low back pain, the first thing we obviously have to think about is the fact that we're sitting a lot more than we're really designed to sit, right? And that's going to create several mechanical stresses on the body. If you think about, especially with COVID here, how are most of us spending the vast majority of our day? We're sitting at a desk in front of our computer, we're slumped over, we're turtling. So we're doing that, a little bit of excessive cervical extension there as well, potentially. And so that's going to exaggerate all the different curves of the spine, which is going to result in some chronic stress, especially at those transition areas. Wherever the spine changes the shape of the curve, going from more of a lordotic to more of a kyphotic curve, that's where we're going to a lot of times have issues manifest, right? So we think about the lumbosacral junction, we think about the thoracolumbar junction, we think about the base of the neck as well, where we have that cervical spine transition into our cervical spine. And so one thing I'll be talking about today is just some basic ideas for what you can do with yourself and with patients as far as improving posture, right? And there's both passive and active methods to do this. Core strength, you'll hear over and over again in lots of different resources on low back issues, the importance of core strength. And really the way I talk to patients about this is I say, hey, this is your body's built-in weight belt, right? So if you learn to properly engage your core, anytime you're bending over to pick something up, even just bending over to brush your teeth, if you properly engage your core first, you're going to be less likely to injure your low back. So especially from a prevention standpoint, that's going to be an important consideration for a lot of folks as well, long-term especially. Looking at the lower extremity influence on the pelvic tilt, we got to think about the hamstrings and the quadriceps. And so part of the assessment of any patient that presents with low back pain is going to be saying, hey, do they have hypertonic hamstring or quadricep muscles? Because that's going to affect the tilt of the pelvis. And by affecting the tilt of the pelvis, it's going to influence the curvature of the low back, either exaggerating that lordotic curve of the low back or potentially flattening it. So we're going to look at that as well. I'm not going to spend a lot of time talking about emotions and low back pain today, but absolutely, I myself have personally experienced the impact of emotional stiffness or stuckness on the low back. As you all probably are well aware with the work of Wilhelm Reich and other folks that really talk about how emotions can become anchored in the body tissues, right? And so really, how do we address and treat the cause for these issues? We have to address those emotions. We have to work through them. We have to dialogue. We have to do whatever we can, whether it's movement or therapy, in order to release that emotional stiffness. And that will help a lot of times with the low back pain too. As an aside here, I'll also share that one of my favorite things to do for my own low back, if I'm ever having an act up, because I have my maintenance plan that I do, and usually it maintains my back pretty well. But if I ever do feel like it's starting to get stuck, what I'll make sure to do is sit down and do something like the microcosmic orbit from Montauk Chia, where we're learning to circulate energy throughout the body to redistribute those areas of relative energy excess throughout the body. And that in and of itself can also be extremely helpful with low back pain. So we're more concerned with low back pain, and this is just partly my disclaimer here, right? Because we're talking generally about low back issues, but especially if we have a history of trauma, any association with neurological signs or symptoms. So any numbness, tingling of the extremities, loss of urinary or bowel control. Those would all be much more concerning signs or symptoms. Someone should definitely get worked up for that low back pain, along with anyone who has any pre-existing or other systemic signs or symptoms or conditions, especially weight loss and fever. We're thinking here about the big C, cancer. Certainly can manifest in the spine as well. And so especially if we're seeing that association with weight loss and fever, they definitely need to be worked up and need to go in to see someone. The nutshell with low back pain is relative rest. Rest a lot of times will solve the issue. So it's that tincture of time, 3 to 4 weeks is usually a good amount of time for conservative care. With an acute injury, a lot of times we're going to encourage folks just to rest for potentially up to 48 hours. That can be one of the best things they can do. And I'll show you my favorite pose for that in a bit here. But generally we're thinking 3 to 4 weeks. That's kind of my threshold for when someone should go in to get worked up if they haven't already been. So we talk about the fascial sling, right? So the fascial sling is essentially the ligamentous connections that go down the anterior portion of the torso, through the pelvis, and back up the low back. And this myofascial sling supports the vertebra of the lumbar spine and also is definitely going to influence pelvic mechanics. So one other consideration for low back issues might be going to see a pelvic floor specialist. To address the pelvic influence on the low back. It's all connected. And so certainly pelvic floor specialist might be another good person to bring into the team for a patient with chronic low back pain that isn't resolving. In the nutshell here again with the fascial sling is that injury to any part of the system can have much more widespread effects. So here's just a little bit on some of what we say when we say it's core strengthening, core abdominal strengthening. What are we talking about? Well, we're talking about the external obliques. Right? We're talking about the external obliques over here as well as some of the internal obliques. So the two of these together are going to create a meshwork around the abdomen. One of my revelations with core strengthening personally that I can share is I was doing sit-ups and, kind of your traditional crunches, which have now unfortunately been shown to be not so great for the low back and for low back health. And I didn't understand why my abdomen was kind of pooching forward so much, and Dr. Robert Martinez, who's one of my phys med mentors, said, hey, you really have to engage your core while you're doing those abdominal exercises. Because again, this is like your body's built-in weight belt. Once you learn how to properly engage the internal and the external obliques, as well as the other core abdominal muscles, that's going to enable you to stabilize your pelvis, stabilize your SI joint, and more safely perform whatever activities you have to in this life. Anything else I want to emphasize here? So yeah, most folks, when they think about the abdominal muscles, they think about the rectus abdominis, right? This is your six pack. It merges the linea alba centrally here. But really, we're talking about the obliques, especially being key, as well as the transversus abdominis muscle when we're talking about abdominal core muscles. Here we see another illustration of that abdominal sheath, right? We're seeing the influence to some extent of even the pectoralis muscle and the serratus, and how that can, again, help to create this sheath around the abdomen. Again, not only containing those contents, but reinforcing, strengthening, and protecting the low back. So when we talk about core strengthening, what we're looking at here is we're looking at a stabilization of the SI joint through the proper engagement of these muscles we've been discussing, again, especially the obliques, as well as the transversus abdominal muscles. It's going to increase the stability of that SI joint, especially if we can evenly distribute those mechanical forces that the low back is subject to, because what we're especially concerned about is asymmetrical loading of the spine. Right? So that's a lot of times when we see folks get injured, they're on one leg in kind of an awkward position, and they're picking something up. That's a lot of times when injury is going to occur. So if we can properly engage these core abdominal muscles, again, it's going to be a protective effect, make it at least less likely that that's going to be occurring. So when we're talking about the core abdominal muscles, again, we're talking about the obliques as well as the transverse abdominals in the front of the torso. In the posterior portion of the body, we also see that fascial sling continuing around the pelvis and up into the glutes, the IT tract, iliotibial tract muscles, as well as the lats. So here again is an illustration of that fascial sling, just a slightly different perspective here. We see that the rectus abdominis is just a very interior portion of this fascial sling. And we have this sheath of the obliques as well as the transversus abdominis muscles that hold it in. So, there's going to be a couple general approaches we're going to think about when we come to low back pain. Acutely, we're thinking about rest, right? So the psoas relaxation pose is something that Peter Gostu talks in his book about ending low back pain. And with the psoas relaxation pose, I'll show it to you in a sec here when I do one of my favorite core strengthening exercises out of that. But essentially, you're laying on your back, knees bent, feet flat on the floor. It's a very safe position to keep that lumbar spine in a neutral position. So it's a good one for folks to rest in after acute injury. If there's been any history of trauma, we're of course going to order imaging at this point in time. And when I say conservative treatment, I'm thinking about things like topical anti-inflammatories, maybe some systemic anti-inflammatories as well. But I'll talk in a bit here about topicals and why I think they're so beneficial for a complaint like low back pain, especially. Analgesic support, certainly you could look at, there are various philosophies around pain, right? And one thing we always think about with regards to pain and injury is that pain is a teacher. And so we've always got to balance that impulse to relieve pain along with the fact that, hey, that pain is potentially limiting that patient, preventing them from doing activities that otherwise would injure them. And right now I've got a bit of an ankle sprain. So I'm struggling with this a bit because I've got a lot of work to do in my garden this weekend. I've got raised beds to build and all kinds of stuff to do. But my body's telling me, hey, I might need to rest. And I'm trying to honor that as much as I can, even though it's difficult because we all only have so much time. Something else I would certainly highlight here would be the role of hydrotherapy, right? So we think a lot of times about ice potentially right after an injury, especially in those first 24 hours. Certainly in minor surgery world, that's something that I love to have folks do, is to ice that surgical wound as much as they can the day after surgery. It's extremely helpful with analgesia, in my experience, reduces local inflammation. But after 48 hours, we want to switch to contrast hydrotherapy. And for those of you who are not familiar with contrast hydrotherapy, it's essentially a series of 3 applications of hot and cold treatments. Right? So for the low back, this might be a situation where you would get 2 hand towels, and you would get one that you would roll up and you would put in water as hot as you can get it without burning yourself. You apply that first to the low back. That heat is going to cause vasodilation. So it's going to cause your blood vessels to expand locally. As soon as that starts to cool down, or after 3 minutes, whichever comes first, you're going to switch over to an ice cold towel, which is going to cause vasoconstriction. So you do that 3 times, the heat again causing vasodilation, expansion of the blood vessels, the cold causing vasoconstriction. And what you're doing is you're pumping blood through the area. And as we know, blood flow is essential for wound healing, for tissue healing. You're going to bring fresh oxygen and nutrients into the area to facilitate tissue healing, as well as flush out inflammatory mediators. And a protocol that I really think makes a lot of sense to me is to then follow that contrast hydrotherapy with some kind of a topical anti-inflammatory. You've increased blood flow locally. It makes sense that the tissues are primed to really soak up that anti-inflammatory that's being applied topically. Typically, I would have folks do this twice a day, morning and evening, if they're able to. It's obviously going to be easier if you have someone to help you. If folks can come to the clinic and do it at the clinic, great. I'll do it for them there. But this is certainly something that can be done at home as well. So long-term with low back pain, I'm absolutely going to look at posture with folks. I'm absolutely going to look at the emotional impact on low back pain, both the potential impact of emotions on the pain itself, as well as that psychological impact of having long-term pain. You know, that's something that I think we really need to address and account for in our patients as well. It's just the fact that being in chronic pain is psychologically wearing, and so counseling, therapy again, as well as potentially even some nervines like Avena, sativa, oat straw is a classic one that I'll put in a lot of formulas specifically for that reason, to help folks with the emotional impact of that pain. So if we're thinking about things like muscle spasm, facet or segmental dysfunction locally of the vertebra, SI joint of the pelvis itself, potentially could be looking at myofascial issues, myofascial trigger points. Disc injuries need to be assessed, absolutely. As well as more mild injuries. We're again thinking about relative rest, topical and systemic anti-inflammatories, especially, and then really looking towards how do we create a low back maintenance plan. I have here a low back healthcare plan, but I really think of it as a low back maintenance plan. It feels like I've been having a lot of patients recently who are getting in their 40s and 50s and kind of hitting that wall where they're starting to have more issues, more medical issues, more pain. It happens at different ages for all of us. The analogy that I heard several years back that I love is, as the body gets older, it's kind of like that old pet that's really dear to your heart. You're not going to just kick it to the curb and say, oh, you're not functional anymore. No, you're going to have more patience with it. We have right now a 12-year-old blue heeler mix that I love, probably one of my favorite dogs I've ever had. But she takes a little while on her walks, and I have to lift her up into the car. And there's things like that that you're going to have to do for your body. And so I know for my back, I have my low back care maintenance plan that I'm, again, happy to share with you all. It takes about 10 minutes each morning. And if I do that consistently, my back does pretty well. If I miss more than 2-3 days, then I'm having issues potentially, or I'm at risk for injuring myself. So having some kind of a low back maintenance plan, again, I kind of think about 10 minutes a day is doable for most folks, hopefully. And then thinking certainly about myofascial work and spinal manipulation. I'm not going to be talking about that too much today. This is something that I do a lot of in my private practice, as well as here at the Baxter Center for Natural Health. High velocity adjustments can be extremely helpful. I'm a fan of the more indirect work as well. Some more indirect work, you're going more into that direction of ease and really trying to ally with the body when you're doing manipulation to facilitate change. So let's talk about anti-inflammatories and analgesics. So I already mentioned contrast hydrotherapy, right? By moving more blood through the region, through the low back in this case, They're going to help to flush out some of those pro-inflammatory mediators and help to facilitate tissue healing. So contrast hydrotherapy makes a lot of sense. And then I'll typically follow that with some kind of a topical preparation. One of my favorites is Tramiel. It's a topical homeopathic preparation that, especially following acute injury, can be really helpful. I had a really bad ankle sprain back in 2001 in Sydney, Australia. It was right before New Year's Eve, and my sister and I wanted to go out and have a good time. So I basically spent a day resting, slathering my ankle in Tramiel, and I was able to go out that night. Does it always work that good? No, of course not. But it is certainly one that can be helpful with acute injuries. As far as topical botanical preparations, there's a whole history here. I'm going to barely scratch the surface, honestly. And one of the main active constituents I think about are salicylates, right? So salicylic acid, of course, is what we think of with aspirin, right? Originally came from the willow bark, from the white willow, Salix alba tree, from the bark specifically. But there's other herbs that also contain salicylates. So I think of a lot of the mints being great, potentially topically. Certainly you could make something like a willow bark tea and apply that topically. As far as topical preparations for different botanical medicines, one of my favorite ways to deliver that is going to be as a fomentation. So to make, for instance, a really nice tea of those medicinal herbs, and then to soak a washcloth in that tea, and apply that over the low back, for instance, and leave it in place for at least 10 to 15 minutes, if not a little bit longer. It's a way to hold that herbal tea in contact with the skin for a longer period of time. One of my favorite anti-inflammatory and antispasmodic topicals that I found in the last few years is a Ayurvedic formula called Maha Naryan. I should have included a picture of it here now that I say that, but it's got like 30 herbs in it. This is a 300-plus-year-old formula, so it's been around the block. It's been tried and tested. Back before COVID, I was in the Bastyr dispensary one day here when I was in between patients, and I had a spasm in my upper trapezius. So I said, hey, let me just try a little bit of the Maha Naryan oil. They still had testers available then. Rubbed a little bit in, instantly took care of the muscle spasm. And since then, I've used it with a lot of patients. And I really, really think it works well. So it's definitely one to check out as far as pain relief, spasm relief locally. I had a 12-year-old at one point with some fairly severe spinal scoliosis. His parents weren't ready for the surgical procedure to correct it. It was an anatomic scoliosis. And so I was looking for options for him. And one that we considered was topical diclofenac. Right? So diclofenac is an NSAID. Brand name is typically Voltaren gel, right? But as an NSAID, we of course associate all kinds of side effects with its use internally. Increased risk of GI bleeding, impact on the liver and kidney and heart potentially. So I'm not a fan of especially long-term NSAID use internally. And you see that a lot of times with chronic low back pain patients. They come in, they've been on ibuprofen, popping 4 to 6 of them a day for years and years and years and years. And you definitely, those patients need to run liver and kidney enzymes and labs to see how their health of their liver and kidney is doing, because that's going to impact it eventually. With the topical NSAID, there's a couple of key advantages. I mean, the first thing I had with it, going back to my 12-year-old, I had a conversation with the pharmacist, how much of this is going to actually be absorbed into his bloodstream if he's using this on an ongoing basis. Because what we were looking for was some pain relief for him that he could use on a daily basis, probably multiple times a day. And so the pharmacist basically was saying in his experience based on what he'd read, about 1% of whatever you put on topically is going to make its way into circulation. Potentially it's a little bit more, but the nutshell here is that, again, it's much less of a concern with the systemic side effects if you're using something like an NSAID topically versus systemically. I've seen this be extremely effective for all kinds of pain and inflammation with musculoskeletal disorders. Typically, diclofenac is going to come in a 1% or a 3% concentration. The 1% is unfortunately the only form that's typically covered by insurance in my experience. But between the two, you can guess which one patients have told me is more effective, right? The 3% is 3 times more concentrated, and therefore it's going to be more effective because we don't regulate the prices of pharmaceuticals in this country. It is extremely expensive for a tube of 3% diclofenac, up in the $360-ish range the last time I checked. And so just practically, that's not going to be useful for patients. And so, it's interesting that down in Mexico and up in Canada, I've had patients report that you can just go into any drugstore and potentially find a tube of 3% diclofenac for around $40 to $60. So just a thought there. But diclofenac topically certainly as an NSAID can be helpful. And then topical capsaicin isn't really an anti-inflammatory, but it certainly can have an analgesic effect. So topical capsaicin capsaicin is one of the active constituents from cayenne peppers and other members of that family. So topical capsaicin, the way we think it works is through a depletion of the neurotransmitter substance P that sends that pain signal to the central nervous system. So essentially, by depleting this neurotransmitter locally, the brain is no longer able to receive the signal of, hey, your low back is in pain. Coaching is really important here with patients in my experience. That first application of topical capsaicin, you get that burst of substance P being released, and it can actually be an increase in pain sometimes with that first application. So you need to tell folks, hey, you got to try it at least 2-3 times to give it a fair shake and see whether it's going to work for you. The other thing that you really, really need to emphasize with your patients too is you got to wash your hands after you use this, because God forbid you now have applied it to their low back and they itch their eyes and now you've essentially maced yourself. So make sure folks wash their hands really, really well after using capsaicin creams. Lots of things we can think about with systemic anti-inflammatory considerations, right? We think about an anti-inflammatory diet, and I wasn't really going to go too much into this here, but you all are probably familiar with the general principles of an anti-inflammatory diet. We think about more of a paleo-Mediterranean type diet, emphasizing lots of veggies, more vegetable-based proteins if they are digestible for the patient, plenty of water, healthy fats, olive oil, avocado oil, and looking at how can we reduce a lot of processed foods. And so as we work towards more of an anti-inflammatory diet, that is also going to, of course, help with their low back pain by reducing systemic inflammation. One of my favorite anti-inflammatory botanicals is definitely got to be turmeric. It is an anti-inflammatory botanical par excellence, also one of my favorite antioxidants for the liver. So good on multiple levels. Turmeric is really pretty safe for the most part. Calcium oxalate kidney stones is one thing you need to screen for with patients. Turmeric does contain oxalate, and so potentially could predispose to more calcium oxalate stones forming in your patients. And so that's something to be aware of and to screen for. Golden milk by far is the cheapest way I've found to get turmeric into patients. And golden milk, essentially, it's an old Ayurvedic recipe again. Typically will be made with ghee and milk. In India, I typically use coconut oil and almond milk, and it seems to work just fine for folks. The challenge is always going to be how to get the turmeric in you. So one of my Ayurvedic herbalism teachers, K.P. Khalsa, talked about that for a therapeutic dose of turmeric, there's 2 considerations. One is that it has to be fresh, right? So a lot of times I recommend this to patients and they say, oh, great, I've got some turmeric sitting on my kitchen counter. No, it's not going to work. Who knows how long it's been sitting there? Who knows how long it was in the store before they bought it, right? So I typically will have folks order this fresh online from one of the companies I use for bulk herbal medicines. And typically as far as dosage, this is the other issue, is that when I see folks taking turmeric, they're getting a turmeric supplement from Costco, say, and they're taking a couple caps a day. That's not going to do anything, right? So with herbal medicine, it's about quality, and it's also about taking enough. It's about quantity as well. And so with turmeric and golden milk, KP would talk about typically anywhere from 3 to 5 tablespoons a day is going to be a typical dose, which is a lot of turmeric, right? And so the issue at some point kind of becomes, can folks actually get that much turmeric into their bodies, right? So with the golden milk, the way you make that is that you typically would melt 1 to 2 tablespoons of some kind of a fat source. So this could be ghee, like I said, it could be coconut oil, over low heat. And then you're going to stir in your 3 tablespoons of turmeric as like a typical beginning dose for folks, 3 tablespoons of turmeric for 2 minutes. The idea is that we're complexing the turmeric with that fat source to increase its ability to be absorbed and utilized by the body. Based on some of the research around increased absorption with turmeric and long pepper, I'll put in a species that's fairly closely related, black pepper, 1/8 of a teaspoon there as well. And then I like to mix in sometimes too, depending on the person's constitutional makeup, either a little bit of fennel, powdered fennel or powdered ginger too, just to support digestive function. Sometimes folks will report that this can cause a little bit of digestive upset. And so if that is occurring, I like to think about fennel or ginger, any of our other botanicals that we love for supporting digestion. So we'll have folks stir that over low heat for 2 minutes. And then you add whatever kind of milk you're using. And again, I typically think about almond milk, and you heat it up and you drink it, right? The challenge from a compliance perspective is going to be that you're left with this turmeric sludge in the bottom of your cup typically. So my easiest solution that I've come up with is I just tell folks, hey, keep adding that almond milk, mix it up, drink it down, mix it up, drink it down until it's gone, right? Because you have to just get it in you, and you got to get that critical base dosage of around at least 3 tablespoons a day in order to have this be effective in my experience. Managing expectations, is also going to be important here. I've had patients that report after a week, oh my God, I feel so much better. My arthritis is so improved on the golden milk. But I've also had patients that, they have to stick with it for a good at least 3 months in order to see, is this working or not? So that's typically what I'm going to tell folks, give it 3 months, consistently taking this. The other consideration here is just that turmeric will, of course, stain everything bright yellow. So do be prepared for that as far as your cleanup and what you're wearing and all that. If folks do have that history of calcium oxalate, stones, your curcumin extracts are a safe option for them. There's a variety of different products out there that are primarily curcumin. There is some research indicating that the whole plant might work better from an anti-inflammatory perspective. And so my preference really, if folks can do it again, is for the whole turmeric extract or golden milk, but curcumin can be a nice option for folks. One of my favorite other anti-inflammatory botanicals is certainly going to be ginger, both through its ability to mediate inflammation systemically, through its inhibition, especially of the production of pro-inflammatory cytokines in the body, as well as its ability to interact with other herbs and act as a synergist and more effectively deliver them to tissues in the body. I have here just my simple recipe for ginger root tea. And so this would be something that, again, folks could drink on a daily basis if their constitutional type works for this. It also could be something that you use with especially the onset of an upper respiratory infection. It's one of my favorite go-tos. This last winter, I especially really liked the combination of a licorice with ginger root. That's a tea that our family just seemed to be making a lot. Licorice has so many wonderful benefits. Antiviral, it's adaptogenic. And so if it works for you, that might be a nice combination too. Generally for ginger root tea, this is the recipe I'm thinking of here. I usually tell folks, go get a 6 to 8 inch chunk of ginger root from the grocery store, and then do 12 1/4 inch slices in a quart of cold water. We bring that up to a boil. And because a lot of the medicine in ginger, the gingerols especially, are volatile, and they will evaporate with that heat, we want to make sure that we keep the pot covered that we're making our ginger root tea in. And you want to steep it for at least 20 minutes. You can certainly go longer with ginger root, but at least 20 minutes. Strain it. You can add a little bit of honey. You can add a little bit of lemon. You can just drink it straight for that matter too. If you're feeling congested and you want to really work on increasing circulation in the head region, a little pinch of cayenne pepper can also be really nice in your ginger root tea. Proteolytic enzymes. So boswellia is another option here for anti-inflammatory considerations through inhibition of the 5-lipoxygenase pathway. I'll mention that just before I come back to proteolytic enzymes. And boswellia is one of our resins that we love, antimicrobial effect as well, and just another anti-inflammatory to consider with folks systemically. As far as our proteolytic enzymes, there's a couple different ways that these will work potentially to help with inflammation in the body. First, my caution, right? These will inhibit platelet aggregation. And so they are one of the few supplements that I really feel strongly about taking folks off of, ideally 2 weeks before any major surgical procedures. But with proteolytic enzymes, we actually like that as far as the wound healing process too, because something like bromelain, for instance, can be really nice to help dissolve fibrin clots after a procedure. So usually 2 days after a procedure, I might have folks start bromelain in order to help dissolve some of those fibrin clots and restore blood circulation to the area that's been surgically corrected or repaired. There's different proteolytic enzyme products out there. Rubinstein is one that I use a lot, especially with acute injuries. And you have to use, again, enough of it in order to have an effect. But Rubinstein is a great one. Bromelain can, again, be a nice proteolytic enzyme. They're thought to work in the body by breaking down some of the pro-inflammatory mediators. And so they therefore will help to reduce, again, systemic inflammation. One of the other caveats with proteolytic enzymes is that they have to be taken on an empty stomach. If you take them with food, they will help with digestion, which is great. There's no harm in that. It's just that they potentially are not going to be as effective at reducing systemic inflammation. Then we get to connective tissue support. So when we're thinking about systemically, how do we help to repair these injured tissues? We think about a couple different things for connective tissue support. One of my first go-tos would always be something like gelatin. I really like Great Lakes Gelatin. It's a company that tends to test fairly well for heavy metal toxicity, and you can have folks just order a canister of it. Typical SIG is going to be like a tablespoon a day dissolved in water. But what you're doing with gelatin or collagen, and gelatin is essentially just hydrolyzed collagen, you're essentially providing the amino acids you need in order to rebuild that connective tissue. So for different joint issues in the body, for low back issues, potentially for skin, hair, nail issues, something like gelatin or collagen would make sense just to integrate into the daily routine of someone who needs that additional support. I always tell patients, hey, you can make Jell-O, so you can make some Jell-O with your gelatin and eat your Jell-O as medicine. How great is that? Make a nice little hibiscus tea Jell-O with some blood pressure reducing effects and some connective tissue support at the same time. I love it. Vitamin C is good for so many things. Typically, you want to get folks at least 3,000 milligrams a day of vitamin C. You certainly can increase it from there. Vitamin C is very safe. It's a water-soluble vitamin, so it's not stored in the body. What happens is if you have extra vitamin C, essentially it stays in the lumen of your intestines, and through osmosis, it'll draw water into your gut and you'll have diarrhea. So that's one way you can tell you've had enough vitamin C is you start to get some loose stools. By the way, it's a very gentle way to help with constipation, in addition to the basic things we always think about, increasing water, increasing fiber, maybe give them a little bit of extra vitamin C. So vitamin C for connective tissue, important especially for collagen formation. Zinc we think about for a whole variety of different things in the body, protein synthesis, DNA synthesis, and connective tissue synthesis as well. There's lots of other nutrients we could add in here, but there have been some good studies, especially on glucosamine and chondroitin sulfate, especially with their ability to help rebuild articular cartilage. So for knee osteoarthritis in particular, there have been a couple studies on these substances, and therefore they're potentially helpful, especially when we're having degeneration of the spine or different joints in the body. And again, this would be an instance of when you have to manage expectations. If someone's going to go on glucosamine and after 2 weeks say, my low back doesn't feel any better, that's probably not long enough. For honestly, something like glucosamine or chondroitin, I'd give it like 6 months of consistently taking that nutrient to see whether it's going to help or not. So protect and prevent re-injury is the name of the game. Generally with acute injuries, we want to avoid causing pain. It's hard for patients, right? We all want to kind of test it and push it a little bit and see, can we do this now? But as much as we can, have folks rest for at least a day, ideally beyond when they're in extreme pain, to avoid further stressing those already inflamed and injured tissues. And then we get to posture training. So Couple different thoughts here. So the idea is that we want to maintain a neutral position in the spine in order to reduce that mechanical stress on the lumbar spine in particular. So for those of you who aren't familiar, the McKenzie technique has a lot of great tools and modalities and exercises here for chronic low back issues, especially. One of my favorites is the McKenzie lumbar support roll, which essentially is a foam roll about yay big in diameter. It's got a cloth cover on it. It's got an elastic strap that goes around the back of your chair so it stays in one place. And you ideally would position that right at your belt line when you're sitting in your chair in your office, or when you're sitting in your car for that matter too. I have one in both locations. And the idea here is that it's going to keep you from slumping and collapsing at the lumbosacral junction. It's going to hold that pelvis up in a neutral position, and therefore it's going to take some of that stress off of, in particular, the lumbosacral junction. I actually like as well the idea of having a second lumbar support roll going up the spine. The idea there is that it's serving as a physical cue. You should be able to wrap your shoulder blades back around it and stay in contact with it during the entirety of the time you're sitting. And that's going to serve as a physical cue to let you know, hey, I'm slumping. I need to sit up here. So you can buy the official lumbar support rolls. They really aren't that cost prohibitive, honestly. I've also certainly made these before with just a bath towel rolled up, rubber band at either end. Works great. If you want to go for something a little bit cushier, a nice piece of felt actually is a lovely way to do this as well. And it's a little bit softer here. And this is really one of the major rationales as well for spinal manipulation, that we're trying to maintain that neutral position of the lumbar spine, the neutral position of the pelvis as well, to take further mechanical stress off of this compromised area. And then we always think about exercise and massage. We're trying to increase circulation. We're trying to strengthen tissues here. Here is another culprit with a lot of low back issues, the psoas. So the psoas is one of the major hip flexors and stabilizers of the trunk. It's active pretty much all day long. You know, you're sitting, you're standing, you're moving around, the psoas is going to be firing. And so this can become inflamed and irritated and tight with a lot of folks. And so really there's only a couple ways to work it. You can do a psoas pin and stretch in office for patients, which is something that I do quite often to help release that psoas muscle. There's MES stretches that you can do in office for the psoas as well. But a lot of times just having the person lie in the psoas relaxation pose, as Peter Goskew calls it, can be extremely helpful for helping to release some of their low back tension. And so again, that looks like you're just laying on your back, your knees are bent, your feet are flat. That is your psoas relaxation pose. And it's going to be how we're going to do some core strengthening in just a second here. The other way you can potentially get at least to the very distal attachment of the psoas muscle and where it feeds in with the iliacus muscle as well is if you do a lunge with a twist. And this is, again, where posture is really going to come into play here. You got to really tuck that pelvis of that back leg. You got to twist slightly away from that back leg as well in order to actually get that stretch in the iliopsoas. It's difficult to do, and it's also partly a stability issue for a lot of folks. So I typically will recommend the psoas relaxation pose when I palpate that psoas in office, and I find, hey, this is really hypertonic and likely is contributing to this person's low back pain. So here's some of our considerations for designing a low back health or maintenance program, thinking again about stretching the hamstring and the quadricep muscles, especially if you find that they're hypertonic, or we look at pelvic tilts and we find that it's not that normal declination of 10 to 12 degrees from the PSIS to the ASIS, but it is either exaggerated, in which case the pelvis is rolled forward. And we're thinking, okay, maybe now the quadriceps are playing a role in that position of the pelvis, or it's decreased, in which case we're thinking hamstring hypertonicity could be a role. Either way, they have to be stretched and released. The iliopsoas muscle we'll be talking about in just a second here, and then strengthening core abdominal muscles. So I think, look at that. I think I have just enough time to show you a couple exercises here. I'm gonna try my best to do this gracefully and rotate this over to my table I've got set up here. Can you all see that? Excellent.
Yes.
Looks
Right, so
great.
Hopefully you can still hear me as I'm doing this. I'm going to go on over to my table here. So this is the psoas relaxation pose. And you're on your back here. This is just a great, again, position for a lot of acute low back issues. Will allow folks just to relax that psoas muscle. You can combine this with all kinds of wonderful things. So this is a great time to do some castor oil massage of the belly. You can put some heat under your low back with like a nice little heating pad. All that are great options to utilize folks' time with this. And usually I'll say relax in this position for 10 to 15 minutes before bed. It's a good time of day to do that. In the morning, I like to have folks do some core strengthening exercises starting from this position. So the first piece here is I'm going to show them those pictures I showed you all of the transversus abdominis as well as the oblique muscles so they can visualize the muscles they're trying to engage. And then I want them to feel how they're engaging those muscles just on either side of the rectus abdominis muscles here, right? So we're in this position, we breathe in. At the end of inhalation, you engage your core muscles. The belly button should scoop in and up. And we imagine an X going from the ASIS towards the belly button, as well as from the bottom of the rib cage towards the belly button, engaging those obliques. And now we're going to exhale like we're blowing out a candle while moving the knee from that resting position up to 90 degrees and slowly back down. The whole time we're engaging the core. That foot lands. We now relax our core abdominal muscles. We breathe in, re-engage them, and we're going to exhale again like we're blowing out a candle. Moving that other knee now up to 90 degrees and back. The foot comes down, we relax. So you continue going back and forth until either one of two things happens. Either that patient feels like, hey, I've got a really good abdominal muscle workout, which might happen initially after the first minute if they haven't really conditioned themselves, or 2 minutes have passed. So the doc I learned that from, she called it her 2-minute miracle. That was probably the number one thing you can do for low back issues. All right, how are we doing timing wise? I think we're probably at a good place for questions here.
Yeah, this is just so great. Thank you so much. What a great way to start a long weekend, right? With some great tools and supportive ways to take care of ourselves. So I'll jump into the Q&A. We have a question coming in from Laju Kumar. Where do we get Tramiel and also fresh turmeric? Do you have any suggestions?
Tramiel you should be able to find online. Certainly, any natural dispensary should have it. It's produced by Heal, and Heal has a lot of great products out there. They're compound homeopathics, and for any of you pure homeopaths out there, you may I know my mentor Dr. Ivans would call it kind of shotgun homeopathy, and maybe look askance at it, but it's a really useful product, and especially for patients to use when they haven't been worked up, you've had some trauma. Go get some Tramiel, makes sense. As far as fresh turmeric, my two sources that I usually will send folks to are either Mountain Rose Herbs or Banyan Botanicals. Either one, they sell to the lay public, and it's cheap. It's so cheap. It's like $18 for a pound of turmeric. Last time I checked on Mountain Rose Herbs, organic turmeric, $18, probably last you about 3 months or so at 3 tablespoons a day for a pound of it.
Yeah, really great small companies too. We're great to support them with really great ethics. So another question from Kim Myers. How long do you keep the heat ice on for each cycle of contrast hydrotherapy?
Yeah, good question. So the classic distribution is going to be 3 minutes hot followed by 30-second cold application. You're going to do a total of 3 cycles. So hot, cold, hot, cold, hot, cold. The thing I tell patients a lot of times is that once the heat dissipates, they can't feel that it's hot anymore, switch over to cold right then, because we want that contrast in temperatures. And if we wait 3 minutes, a lot of times with just hot water from the tap, it's not going to be hot enough that it's going to last 3 minutes. It depends on the thickness of the towel and how well they saturated it and all that. But typically I'm going to say, as soon as you feel that heat dissipate, switch over to the cold.
Great. Another question coming in from Brandy Holmes. Have you used the PSO right tool for psoas release? If so, have you found it helpful?
I'm not familiar with that. I'd love to know more. PSO right tool. Interesting. No, sorry, I don't have any info on that.
Psoas release, we'll have to check it out.
Cool.
Let's see. Can you show all 4 stretches in a row?
The different stretches I talked about here for this, the quadriceps and hamstrings too. Sure. Let me rotate the camera back here. I wish I had an assistant here that would make it easier, perhaps. Let's cut, all right, hopefully you all can see me. I'm going to kind of gauge roughly. So quadriceps stretch, right? One thing I like to have folks do, let me grab a chair here. So I like to have them have a chair for stability. You know, it depends on who you are, but one-legged poses may or may not be your forte. One thing to think about with one-legged poses too, I learned this from a friend of mine who's an Ashtanga yoga instructor, is the tripod, right? We want to ground down that first metatarsal phalangeal joint. So you should have 3 points of contact. Let me raise my foot up here. The base of the first metatarsal phalangeal joint, the base of the fifth metatarsal phalangeal joint, and then your calcaneus. All 3 should be in contact, and then you'll be stable. You can help yourself here by raising your big toe. That's why yoga teachers will tell you, hey, raise your big toe when you're doing a one-legged stance. It helps to ground that first MTP joint. And then the other thing I will say to folks a lot of times is, hey, have a chair next to you here so you can grab onto it if you need it. I'm going to move it for our purposes so you all can see, but just for a safety consideration, especially with anyone with any instability, really important they have that there. So with the quadriceps stretch you all are probably familiar with, let me show you a couple of caveats. So one is you want to be in an anatomically neutral position, meaning a lot of times folks will let that leg they're stretching drift forward, not to the side. You want to have them in front of a mirror ideally. So they should literally have just picked up their lower leg. Anatomically neutral position is what you're going for here. The second caveat is you want them to imagine that they're pulling up on their belt buckle, tucking their sacrum, pulling up on their pubic symphysis on their belt buckle essentially. What that's going to do is it's going to move that superior attachment of the rectus femoral muscle, the AIIS, just an inch or two superior, and that'll make a big difference. You'll get a better stretch that way. So for a lot of folks, that's going to be a good one. Probably my favorite hamstring stretch is going to be this one. Here, I'll even take off my belts for you all so I can show you how to do this. As far as low back folks, especially, this is the safest way to work with the hamstrings. You know, you all probably are familiar with the runner stretch, right? So this is how a lot of people think about stretching the hamstrings. And that's fine for a lot of people. One thing I would emphasize, you don't need to do this, right? If we think about the attachment point for the hamstring muscles, superiorly, it's going to attach into your ischial tuberosity. So really, coming up and coming forward with a properly engaged core, just 2 to 4 inches should be more than sufficient to stretch your hamstrings if you're doing the runner's pose. The safest way to stretch your hamstrings, though, is going to be where you're on your back. You're starting again from that psoas relaxation pose. And you want to use a belt or a strap around the ball of your foot. You're going to bring it up like this for your hamstring stretch. It's a great one. There's all kinds of caveats there, but that's a great one. You know, I will share with you all too some McKenzie press-ups. So McKenzie press-ups, the one caveat I'll say here, if you have any disc herniations, any neuropathies, please don't do these. Any of these exercises, if they're causing you pain, especially sharp shooting pain, please stop doing them because you may have a more serious pathology going on there. But with McKenzie press-ups, this is a passive mobilization of the lumbar spine. So the idea here is that you're increasing mobility and movement in the lumbar spine without increasing muscle tension. And so for the McKenzie press up, you start on your belly. You're going to slightly pigeon toe your feet in order to open up your pelvis and relax your pelvic girdle. The key here for the McKenzie press ups is you really want to focus on those low back muscles, ask them to relax completely. You do all the work with your arms, and it looks like this. So you're just pressing up until your pelvis just starts to come up off the ground, and you're back down again. Up and down. 10 repetitions typically. McGill in his low back disorders book talks about how he doesn't really like the pumping action of the McKenzie press up as much as just holding this position. So this actually can be a nice relaxing position for low back issues too. On your stomach, one fist that you're resting your chin in. Again, will help to open up that lumbar spine. All right, other questions?
Hey, a couple more questions.
Okay.
So a question coming in around when you're doing exercises, how would you tighten the abs on any activity? So for example, with yoga, they'll say to pull your belly button towards the spine. Do you have other techniques around doing that?
Yeah, so it's about building awareness more than anything. And so that exercise that I showed you all with from the psoas relaxation pose, really my favorite part about that exercise is, yes, you're toning the core, yes, you're building strength, but you're building awareness of how to engage those muscles. Because you're absolutely right. One of the main issues with core engagement is folks just don't know how to do it, right? They think they've got to hold their breath. You shouldn't have to hold your breath to engage your core. I'm engaging my core right now as I'm talking to you all, right? So with the belly button piece, I think of it as more of a scoop than a pulling straight in. So you want to scoop in and up with the belly button. The other pieces I think about when I'm engaging the core, one is ideally thinking about performing a Kegel as well. Again, engaging that pelvic fascial sling. So we pull up on the perineum. Belly button scoops in and up. And then as I mentioned, that X imagery is what makes the most sense to me, that you draw an X from your ASIS, what most people call the hip bones, but is actually your anterior superior iliac spine. You should feel a pull towards your belly button. You should feel a pull from that inferior border of your ribs, of your 12th rib, towards your belly button. So we have an X going this way and that way, as well as pulling in with the transversus abdominis. And then it's a scooping in and up to properly engage the core. And again, monitor, always monitor, and make sure that you're feeling that increased tone, and you should feel a difference there.
Wonderful. And the last question, do you know, and if you do, what do you think about the foundation exercises? I don't know if you're
not familiar.
Okay. All right. Well, I just want to thank you so much, Dr. Rubinstein. Again, you make me nostalgic to be a student again. You're just such a wonderful professor, and anyone who's at Bastyr learning from you is really just so lucky. So thanks for being here for our community. And I hope you just have a really wonderful long weekend coming up here.
Thank you so much. I really appreciate the opportunity to share some what I've learned over the years, and just really value your work as well.
Great. So just to close out, I wanted to thank you all for coming. I want to invite you all to our next Friday Wellness webinar, which will be September 17th, same time, Friday at 12 p.m. And we'll be talking with Dr. Jacqueline Chassie-Smeaton, also a naturopathic doctor, also a Bastyr graduate. She'll be introducing Wellevate Labs, just an incredible new feature on Emerson Ecologic's Wellevate platform. So we hope you join to check that out on September 17th. I'd also like to invite you to our just incredible annual conference that we have every year. This year we will be having an in-person conference and an online conference. It will be hybrid, October 29th to 31st. We have over 50 incredible speakers from so many different clinical backgrounds. We really invite you to check that out and join us for the People Planet Purpose Conference. And once again, if you are interested in studying more deeply with us, you can look into joining the Integrative Health and Medicine Fellowship. We have a October cohort starting, and if you mention Joshua's webinar and you are a new applicant, you're eligible to receive $1,500 off your tuition if you join the fellowship. So again, thank you all for being part of our community. If you're interested in becoming a member with the Academy, we'd love you to join our interprofessional global Association. And all of our webinars are free. You can find them on youtube.com/AIHM Global or on our Facebook page. So if you really liked this presentation with Dr. Rubinstein, come back and watch it, share it with your friends. It's usually posted within an hour or two after our webinars are finished. So again, Dr. Rubinstein, thank you so much for this wonderful webinar, and we will see you all on September 17th.
All right, take care.